Do you know Polly Murray's story? How she was very important to the discovery, controversy, and advocacy in Lyme disease? This is part of a Common Sense Lyme disease series where I discuss cases, but also issues that come up in my practice. So let's begin. Now, it started with a mother's observation. So in the early 1970s, she noticed strange symptoms in her family and neighbors. There's fatigue, joint pain, rashes, especially in children. So, as a mother, she went through a lot of work to document 40 cases in Lyme, Connecticut. Now, I met Polly Murray and I know Polly Murray, and she was a marvelous human being. But in 1975, Polly Murray reported cases to the health department. Later, she reported them to the researchers at Yale, who included Dr. Alan Steer, who began an investigation and called it Lyme arthritis. He published a paper. They weren't sure what the cause of this swollen knee. But in 1981, Dr. Willy Burgdorfer identified Borrelia burgdorferi in ticks. He originally suspected it might be rickettsia, it might be another bacteria, but now he found spirochetes in the ticks. So he was able to confirm that Lyme disease, or that is Lyme arthritis, was from a tick infection, a spirochetal infection. Later on, a Lyme titer came along, and then a Western blot. The problem with those tests is they're not as reliable as we'd like. They're being used sometimes for clinical diagnosis rather than what its original purpose was surveillance. So over time, beyond the swollen knee, what was originally called juvenile rheumatoid arthritis, there's been a recognition of other problems like neurologic things like brain fog, nerve pain, heart block in the heart, chronic symptoms. Now, of course, there's even autonomic issues that are important, as well as a lot of neuropsychiatric issues. Now, over the years, Lyme disease was called chronic Lyme for years, or post Lyme, late Lyme. Some doctors have introduced the concept of post treatment Lyme disease syndrome. Post treatment means they've had at least a month of antibiotics, but they refer to it as a syndrome. Now, in the literature, a persistent tick-borne infection is a possible cause, but I have colleagues who just consider it a syndrome and don't recognize that there's a persistent tick-borne infection as a possibility, and then they don't proceed with treatment. So I have patients in my practice who have chronically been sick, who have done well by treating it as a persistent tick-borne infection. There's some basic sciences coming along, like there's something called persisters from the test tube at Johns Hopkins, where these spirochetes can last for much longer than we ever anticipated. They're using the tuberculosis model, where tuberculosis can last for a lot longer than one would think. So that's why a year to a year and a half treatment is given for tuberculosis. So there's a rise in recognition of long-term treatment, but there's also colleagues of mine who don't believe in long-term treatment. There's also a growing interest in co-infections, like Babesia is a good example of a parasite that doxycycline doesn't work for. It's in a tick. It's probably the second most common infection in a tick. So what can we learn from Polly Murray's legacy? First of all, advocacy sparked awareness in this case. We don't know how long they will continue to call these cases juvenile rheumatoid arthritis. They're recalling that juvenile rheumatoid arthritis and giving anti-inflammatory medicines for months to years at a time. Her story reminds us to listen, document, and stay curious. The history of Lyme disease is still being written by patients and doctors alike. Of interest, Dr. Steer has been identified with the pandemic. I've been involved with this pandemic of Lyme disease, but Polly Murray captured her story in a book that's available on Amazon called Widening Circle. And many colleagues, there's been a whole sea of colleagues who have weighed in on Lyme patients, partly because there's so much Lyme disease out there. So once again, Polly Murray started the whole scientific discovery. led to a number of other discoveries, as well as all the co-infections in a tick. So continue to be thankful that Polly Murray, as a housewife, looked into this problem. Thank you so much for joining me for this Common Sense Lyme Disease series. Have a good day.